and I'm hosting this social care session. We have 45 minutes, and what we're doing is looking at the latest digital innovations which have proved critical to supporting councils during these challenging times. They've helped save money, make services more efficient, they've improved the lives of our local residents. As a not-for-profit, iESE is in the game of doing what's good for the sector and continuously scans the horizon for digital solutions that can make a real difference. Today, we've cherry-picked 3 which focus on some of the biggest challenges facing local government right now. These include social care commissioning, safeguarding in children's services, and the case management system of the future. This session is going to be a short, sharp 15-minute presentation from 3 speakers on 3 solutions that can really help in the current challenging times. Because we are short of time, further information and demonstrations can be available on request, but this is about really offering you an opportunity to look at some solutions which, if they match your local needs and challenges, then talk to us and we will match you up to those people so that you can find out further how you might be able to use these solutions. So our 3 speakers are Craig White, Head of Development at iESE, who's dealing with CareCubed, Natalie Ward, Operational Director, Mind of My Own, and Sharif Atia, Head of Design, iESE, dealing with Casey. So we'll go in that order. So Craig, you have 15 minutes for your presentation. Go.
Okay, so hopefully you can see my screen. I'm going to give a very quick introduction to CareCubed, as John said, and some of the latest best practice examples from working with councils around the country. I think it's unprecedented times for social care, and only to open a newspaper or turn on your TV to hear some of the challenges that are being faced by health and social care commissioners and providers currently. So it's a really important tool for councils and health authorities and ICBs to be using. Your authority or commission in your area will be facing many of the issues discussed today. So please do get in touch or pass my details on to relevant colleagues so that you can find out more after today's session. Just to give a quick update in terms of some of the pressures that are facing adult services. Obviously, financial pressures for local authorities and providers are having a big part to play currently. We've also got the white paper from Department of Health recently, which is all about adult social care reform agenda. So lots of change going on within that particular sector as well, which is challenging councils from a resource and a financial perspective. And also from a provider's point of view as well. Care England needed to look at social media to be able to pull quotes like this from the provider side as well. So Care England here are talking about financial pressures that they're facing, energy prices increasing, inflation, cost of living crisis, which we all know about in our own lives as well. So it's a really, really difficult time for everybody involved in social care. They also pick up on a waiting list issue. So councils are just struggling to keep up with a reassessment of individuals and residents within the area to make sure that their support needs are being met. And there's a significant backlog now that needs to be addressed. And these are some of the challenges that CareCubed is helping with on the adult social care side. On the children's services side, there's some similar types of issues in terms of the financial pressures. You can see the LGA there on the right hand side of my slide talking about funding pressures, financial pressures that councils are facing, £800 million overspend, and 8 out of 10 councils being forced to spend more than they budgeted for in children's services, growing demand in terms of children and young people that need those services, and also really difficult to keep people close to their families and friends because of the lack of provision that's available within local authority areas typically. And there's a quote there from a statement there, sorry, from the Competition and Markets Authority report that came out recently, which says that only 37% of children in England in residential placements are staying within 20 miles from their home base. So they are being dispersed, hopefully somewhere close, but in a lot of cases it can be far and wide across the country. And against that backdrop as well, we also hear about some providers making significant profits as well. So it's a really important conundrum to get right in terms of making sure the needs and the support meet the needs of the resident, but also that it works financially, both for the local authority and the provider. And these are all things that CareCubed helps you with. There's a unique national model, and there's lots of data that sits within CareCubed, and this really gives people the evidence base to have a much more informed, open, transparent conversations between providers and commissioners. And having that independent tool, when we talk to our customers, it moves them away from, well, we've created our spreadsheet over here and you've created your spreadsheet over there. This is an independent, nationally recognised, robust tool that's got lots and lots of data underpinning it. So I won't go through all of the data today, but things like land registry give us the land and property cost. Skills for Care give us the salary information in terms of what's being paid in each local authority district for care workers across the country. And the iESE logo gives us what's being advertised within those areas as well. So it gives that evidence base, which is really tricky at the moment because commissioners are getting lots and lots of uplift requests coming in. 10% we need uplift, 20%. I heard one last week asking for 50%. It's really difficult to be able to have that conversation without a tool like CareCubed there to support you. So at a high level, I'm not going to do any demonstration of the tool in the short time we've got available today, but at a high level, we can put in information about an individual or a service. So that's it. That's information about staffing. That's information about the needs of the individuals. That's information about occupancy of that care home, for example. CareCubed then crunches all of that data that we put in and says, OK, well, based on the information that you've put in, this is a sensible price for that package of care for that individual or for that service. So it gets the local authority or the health commissioner on the front foot in those conversations and gives a robust evidence base to be able to have a different type of conversation and understand what it is you're buying and what's being delivered for that person, resident within your area. There's lots of ways that CareCube's being used now. So if you looked at CareCubed before over recent years, you'd have probably been kind of aware of it being there as a tactical tool to help with some of those day-to-day nitty-gritty type conversations between commissioners and providers. But going forward now, it's being much more used on a strategic basis as well. We've been using it for cost of care exercises. You might be aware of the Department of Health's cost of care exercise that's been carried out recently by councils. It's being used to do much more of the modelling side of different scenarios as well, because the reform agenda is driving change, and councils now need to understand, well, if we do this option or this option or this option, what's the impact going to be on our residents and also on our finances within the authority as well. So lots of different use cases that we're seeing CareCubed now being used for. The package that we provide, just to highlight that, so it's the software, low-cost software as a service solution. The good thing about that is there is no IT overhead. We can effectively flick a switch our end and you can access it directly through your browser, so it takes away all of that ag of implementing a new system from an IT perspective. We also provide collaboration tools with the system as well. So the tool can be shared between providers, commissioners, and health colleagues as well, so that you can collaborate on particular cases. But we also provide what we call a community as well, which is where our customers can collaborate and share ideas and best practice with each other as well, which has been really well received across our customer base. The data side of it is obviously really important, and having that data up to date to make sure that it's robust and using the very latest data available. We've just done an update last week, which has built in some of those cost of living changes to support those conversations that councils and commissioners are now having with providers around uplift requests specifically. And the final part of that package that we offer is the implementation support, which is there to embed the solution within your organisation through a series of training, consultancy, and focused on delivering quick and immediate results for you as well. So I'm just going to finish with a couple of case study examples. And I did mention the cost of care exercise. That was a big project for us because this is a national project, and it was commissioned by the LGA, ADAS, and Department of Health. CareCubed was commissioned as the tool to be used nationally by all councils and providers going forward for the cost of care exercise. There's a map of the country there, and pretty much all of the country have used the tool. The ones that are there in orange wanted to be involved in the development of the tool, so really good uptake in terms of that. And everybody else that's blue then used the tool afterwards as well. So about 95% of councils used CareCubed for the cost of care exercise and submitted their data back to Department of Health within the timescales, which were mid-October this year. The providers that were involved in that as well, they accounted for about 2,000 providers in there, which were about 61% of the beds they deliver through those 2,000 providers that were using the tool as well. And this is a really important exercise because the outputs from this will steer central government decisions and funding decisions going forward, and also move us towards a more fair cost of care as well. And it also is about preparing for the care cap, whether that happens or not. I think change of Prime Minister might change some of that in terms of timescales, but preparing for the care cap and making care affordable for residents in the future as well. A couple of working age adults examples and a children's and young persons example now as well. So as well as the 65 plus exercise that CareCubed has been used for, we've got customers that use it for working age adults with disability, specialist placements as well. And we've currently got 40% of councils in the country are using the tool, and that's grown significantly over the last few years. This map is showing orange where we've got adults customers, blue are children's services only customers, and the purpley pink colour are using it across both adults and children's services. And we've seen a lot of councils now using it across both because there's benefit to having that common approach right the way through the life cycle of that particular individual. This is one of our customers up in Scotland. So Moray Council up on the north coast in Scotland have used the tool to develop new services. So they moved some of their residential residents into more supported living accommodation because first and foremost, it was right for those people they didn't need 24/7 residential care. So they developed in CareCubed new services that fitted what those people really needed. Providers had complete clarity on the cost and no kind of surprises with that, and they could plan a bit more long term financially for that new service. And it also improved relationships and made some quite significant savings for the council in this example as well, moving from one 8-bed residential setting to an 8-person supported living service. Save them about £7,000 a week, and over a year those are significant numbers at a time when budgets are really squeezed. From a provider's point of view, they use the tool as well. They don't just use it because councils are using it. It is a tool that is fair and equitable and available to everybody to use. And Lindsay here is talking about it takes the heat out negotiation when they're talking to councils. It reduces uncertainty for them. They're a charity in this example, and shared accountability for changes. And Michael then is talking about actually some of the outliers in their service costs. They're trying to bring those in line with what CareCubed is suggesting as well. So lots and lots of case studies. We will be sharing the slides afterwards and go into more detail. Surrey here talking on the left hand side. Jeremy's talking there about giving more control around costs they didn't have previously within Surrey County Council. And on the right hand side, there's a specific example there where a provider was asking for £1,500 a week more for each person, and the council used CareCubed to evidence that it shouldn't be that. It was something quite different to that, and it saved them about £80,000 there in that one example use case of just being able to evidence that we should be uplifting across these at £20,000 rather than £100,000 across all of our residents within your care setting. So lots and lots of real world examples. From a children's perspective in Surrey, they also use the tool there, and it's really good for that transition process for people that are moving from children to adult services. But also within Surrey, they had a real challenge around 16 plus semi-independent living provision. And they didn't have very good engagement with their providers either. So the solution was to implement CareCubed, but also to implement our negotiation training as well, because the tool gives you part of the answer, but you still need those softer skills to be able to negotiate with providers as well. And the results they've seen from that, your eyes get drawn to the financial numbers on this one because there are some significant savings they made here, but it's the second bullet point that we're most proud of, because what that's meant for their residents is that now they've gone from 35% to 65% of those children and young people that can stay within the county and close to their families and friends from 35% in a year. So a 30% increase is what that's translated to in terms of those people staying local. There is an increase in block bed bookings they've done as well, so about £1.1 million savings on that and 750k on spot purchasing as well. I'm just going to finish on Bristol. So here's Hugh Evans from Bristol, who's the exec director of people in Bristol. They've been using the tool for about a year now as well. And I think he's pointing out here that it's a unique solution, and without it, controlling costs and being able to model future changes is very difficult, if not impossible, for them as a local authority. So if you're not using it, you might be missing a trick. It will deliver immediate results and tackle some of the challenges that are going to arise in the future as well. So please do get in touch with me directly afterwards if you'd like to find out more. Thank you very much for your time.
Craig, that's great, thank you. And as I said at the beginning, these are short, sharp presentations, so they are a bit motoring forward, but it's a way of getting the information into you so that you can decide whether you want more. We're moving on now to Natalie, A Mind of My Own.
Great, thanks very much. Good morning, and my name is Natalie and I work for Mind of My Own, and I'm really delighted to be demonstrating today what we're doing to support safeguarding of children and young people in social care. Just a very short background: we're an award-winning tech company, and our digital participation tools have amplified the voices of thousands of young people now since 2015. And they're very fully co-produced digital participation tools. We use the end user to create them with us, and they help children and young people to participate in and express their views to services in a way that suits them. And as Craig pointed out, we know children's services are facing significant pressures right now, including increasing looked after children numbers, staff shortages, and reduced funding. And our apps are one way to help local authorities and organisations to cost save using effective early intervention, identifying and addressing children and young people's issues quickly, as well as effectively safeguarding young people by hearing their voice and providing the required data for you to create efficiencies. So as we know, we've only got 15 minutes, so we're condensing everything down today. But before I give you a bit more information about the apps, I just want to tell you briefly about our community. So just go to the next slide. So we work with over 450 services within councils, independent providers, schools and youth justice services now. And this community is really built around a passion to hear young people's voices and help them to change their outcomes and life trajectories. That equates to about 36% of UK councils. We also now work with 71 education services in the UK too. And our director at the moment is over in New Zealand, currently talking to our fostering and child safeguarding organisations and community over there too. So what's it all about? What is our solution? And our company does a lot in the social care space. Our products can be used right across a young person's journey through social care. So just to highlight a few things here, I'm going to do a very short demo of the One App product, but this is for young people anywhere from 7 years old and above to help in early help, initial assessments, right through to looked after children. The Express app, which is for much younger children and those with additional support needs, often considered too hard to reach. We really feel that we've addressed that, contributes to young people's education and healthcare plans and creates one-page profiles. The service portal is the back-end system. This is the processing system where you handle each individual statement that's created by a young person. This contains identifiable data. You can track outcomes of young people too. We haven't stopped there. This year's been a big year for us. We created our latest product in April, which is called Exchange. This is the first strengths-based digital participation tool to hear authentic voices of young people using youth justice services. It's actually in partnership with North Yorkshire Council through Vanguard funding with NHS England, and I'll show you a brief example of that too. Shout is our fully co-produced accessible survey tool that's been created specifically for service improvement. And finally, the latest thing for us is Mosaic. So this is an integration with the case management system Mosaic, which means that seamlessly the voice of the child can end up on the case management system just with the touch of a button. So without further ado, I'm going to do a short demo of the One App, our original app, to show you what it's all about. Okay, so this is the landing page that all young people, when they log in, they will see. So young people can have their own account to use it anytime they want to communicate with their service. So you can see here there are a number of what we call scenarios. Okay, so this covers the whole young person's journey through their life and the social care system. Just to give you a few examples, so let's have a look at my worker is visiting, for example. That's a great open scenario, beneficial for open assessments and from when a young person meets a worker. Get ready for a meeting. That can be any meeting a young person might be planning for, so a child in need planning meeting, team around a child meeting, or family group conference, for example. Sort a problem, helps a young person to solve an issue at the earliest stage possible. However, if they wish to file a formal complaint, for example, there are steps in here to help them to do so. Prepare for a child protection conference. This does a little bit about what it says on the tin, but we've seen a change in practice on the back of the data that this particular scenario produced. There's a question in here that asks young people, do you understand why you're having the child protection conference? 37% of those young people said they didn't know why. So that gave the local authority an opportunity to explain further to all young people going through that process what it was all about. Things like My Education, looking at the details around what's going well, what support they might need. Get ready for a foster care review, ensuring the young person's voice is directly in that foster care review experience. So let me just jump into this one, which is My Wellbeing, just to show you what it looks like. So here you've got a mood slider. So all young people can really easily identify what's going well for them, what's not going well for them. This one asks them how happy they are. This gives you a data point, so 9 being happiest, 1 being least happy, and that all comes out in the service portal at the end of it. So My Wellbeing, you're just checking in with a young person. A worker might be sat with the young person, or the young person can complete this all on their own. There's lots of these lovely emojis and emoticons. They can select multiple, they can add their own. This question is, how do you feel most of the time? They can add worried, for example. And the young person can go through this in their own time. And a lot of kind of our peak interest is around 9 p.m. when young people are on their own, perhaps in their room, and a worker has asked them to complete something, or they want to get something off their chest. So things they feel sad or worried about, they can expand. There's lots of free text in here. How have things been going lately? I've felt tired. How do you get on with people at home? How do you cope when things aren't going well? So really looking at some of those resilience and risk factors for young people. Looking at their friendships. How do you get on with your friends? Which of these do you have in your life? Someone who loves me for who I am, etc., etc. And then looking at where they might feel safe. So do you feel safe in your local area? Yes, they're happy there. They can add additional text if they want to. Maybe they say that they don't feel safe anywhere, and that could start a conversation further with a young person. So you can see here there's lots of opportunity for a young person to input into anything that they want to say and create a statement of how they feel. So this last bit here says, if I could tell an adult one thing in my life, it would be. And so this is a really open-ended question. It might be something they want to get off their chest, and they can input that here. So what a young person does is they create a statement, and that's what it looks like. It's quite a formal. Young people told us that they wanted to have a formal document, because sometimes these statements represent young people in meetings that they may not attend. They choose who they send it to. This is a pre-populated list that the joining organisation would select. So for the interest of today, they're going to send it to their social worker, and that statement will go directly over to their social worker, and they just press send. This also acts as a digital diary for a young person. So you can see all these, scrolling back through all my statements here that I've ever created. So that's within the profile. So it gives a young person a sense of empowerment to go back and look at information that they previously submitted. Now, just one thing on this as well, accessibility is hugely important to us, and we partnered with a company called Recite Me, and they provide our accessibility toolbar that you can see here at the top. What this has is you can increase the text size to be larger, smaller. You can change the font, so completely customizing the setup for the young person. You can change the background color to be yellow, or yellow, for example, is great for young people with dyslexia. But one of the key things for us is the language translation. So our apps are available in over 100 languages, and there are 50% of those are text to speech. So for example, here, if we select Arabic, you might be working with an asylum-seeking young person. When you scroll over, it will read the text aloud.
حلقة الوصل استعد لاجتماع.
Okay. Now, what that does is when the statement is created and submitted, it will be in, it's created in the language of their choice, and then when it arrives with the worker, it will be translated back to English. So that kind of prevents a lot of the costly translation that can occur. So I'm going to come out of there. That was just a whistle-stop tour. I'm going to go back to the demonstration on the presentation. And as I said to you, there's a number of data points throughout the apps that we have, and that can really help to transform services. So we know that data serves little purpose unless it does inform practice. It's the evidence you need to build those resilient services. And there's so much data that you have at your fingertips. So this example here looks at how a young person gets on with their carers. So you can see here, you've got the majority of young people are saying that they feel quite positive, but then you have obviously the red section here, the 15%, where the young people have said they feel negative about how they get on with those carers. And you can identify those young people at the touch of a button and make sure that you're putting in the right steps in the red zone, allowing you to act and support them quickly in their placements. The next graph that we have here shows you from data from our new exchange product. It looks at how young people were feeling when they committed an offence, as well as service level feedback on there as well. So since using youth justice services, have things got worse or have they improved for you? And I just want to put a quote on here, and this comes from Jill Corbett, Director of Children's Services and Chief Exec for Together for Children Sunderland. She said that Mind My Own played a big part of them evidencing children's inclusion in their plans and intervention, and has really improved services without a shadow of a doubt. So you work with your account manager to create the reports that are going to benefit you and your service the best. And we are using our apps to deliver service improvement, and we're often cited in Ofsted and Care Inspector reports. So I've just brought up 3 examples here. I'll build those on the page for you now. The first one is from Newham, so please take a moment to read that one. The second one here is from Somerset. And finally, we have a Havering example here as well. So I mentioned earlier on some of our other solutions. So just to give you a snapshot of those, we said that Express is for much younger children. So you can see very clearly here that it is for a younger demographic. It's very pictorial. It has different topics that a young person can use to contribute to their education and healthcare plans and really get their voices heard. A couple more grabs here. It creates a 1-page profile. You can take photographs of yourself as well. Our second solution, Exchange, I mentioned in April we launched this product. It's going from strength to strength. North Yorkshire were a customer of ours, and still are, sorry, and they realised that they needed to increase participation with young people going through youth justice services. So they co-created this with us, and we work with young people going through youth justice services in North Yorkshire to create this through the NHS England Vanguard funding. And you can measure the distance travelled for young people using these services too. So there's a huge amount of data behind the scenes. And the last product I'm just going to touch on now is Shout. So Shout is very much the first child-friendly survey tool available, fully accessible. The data is all stored in the UK. We have a huge bank of questions and provide detailed bespoke reports with recommendations. And again, you can see here it's built on the platform of the One app, so using those emojis that are recognised. So that's our kind of product set. Just kind of summarising again on the page for you now, and I hope that you can see and get a better understanding of how our digital participation tools can really help you to gather young people's views and really increase engagement and play a fundamental role in participation and safeguarding plans. There is my details on this page here. If you have any questions, please feel free to ask, but as John and Craig have said, we are around for any other demonstrations at any point, so please just get in touch. Thank you.
Natalie, thank you. It's a skill in itself to be able to do a short, sharp deep dive, so thank you for that. And as Natalie says, if you want any further follow-up, we're happy to connect you. We now move on to Sharif and Casey.
Thank you, John. Hoping this goes smoothly in terms of our transition. That's great. So welcome, everybody. My name is Sharif, and I'm the head of design at iESE, and I'm really delighted to be joining you today on this kind of wet and windy Wednesday for the annual iESE conference as part of this great social care digital showcase. So thank you to John, Annabelle, and the rest of the team for having us today. And as outlined, we'll be taking you on a real quick whistle-stop tour of our latest development, Casey, social care case management system of the future that is currently in development with iESE. So thank you for having me today. So as we all know, and as Craig set the scene earlier, social care in the UK is under tremendous pressure. I think not a day goes by that you don't hear about this pressure in the news, be that the workforce challenges or financial pressures or unavailability of services creating delayed transfers of care and impacting our health service. I mean, importantly, these pressures weigh most heavily on the people who need our support to live safe, happy lives, and local authority social care teams who strive to provide the best possible care and support to all who need it, be it long-term care or a path to more independent living. Meanwhile, we've discovered that legacy technology and data management tools can fail to meet modern expectations for personal data access or control, or not provide our social work teams with the effective, flexible tools they require. And this can create a number of inefficiencies and really limits the opportunities that are available or presented by digital technology. So what you can see on the screen there is probably quite a well-known graph just illustrating the drop in funding and the increase in demand for social care services since 2009. So why social care case management? At this stage, you might be asking, how can a digital case management tool help with these growing pressures or alleviate these generational challenges? Well, this is not a silver bullet. However, adopting human-centered design methods, we set about trying to understand how digital tools impact the daily lives of social work teams and inhibit the work they do, and therefore the support they can actually provide to people. So today, I'm going to share some of these insights with you before telling you a little bit more about the solution, Casey. So how did we get here? So between April and August this year, April last year, August this year, we worked with a number of different local authority teams across the country. And a lot of these people were telling us lots of stories about their lives in social care and also about the tools they use. So you can see on the screen there just a list of the types of people and the types of roles that we've touched during this piece of research. So social workers right through to foster parents and individuals that have received care in the past. So what did we find out? So one of the kind of sad statistics that we kind of found was that 8% of social work time is spent on computers or completing paperwork. Much of this involves potentially duplicating data or overly onerous processes, and many social workers are not able to work in a kind of modern mobile manner and are required to return home to the office to update systems or databases. There's also a lack of interoperability, meaning data sharing across agencies or between teams can be really limited, which can then stand in the way of early intervention or preventative social work. One of the important challenges that Natalie's team is really tackling is the ability to capture the voice of individuals and have that kind of center in the center of care plans or somebody's actual case file. And these are some of the challenges that we're hoping to alleviate with a modern system, which takes interoperability as a core principle. Furthermore, we also saw a gap between our aspirations for social care as a society and what we can currently achieve with efforts and investments in digital tools. There is also a gap between what is possible with modern technology that surrounds us in our daily lives, yourselves at home, and then what is available to care teams to use in their work. Individual expectations over visibility of personal data and the ability to control that are currently at odds with what is possible with the existing digital technology within social care. In many ways, our current social care records are not modernized or kind of fit for purpose in the modern age if they don't provide supportive practice or modern tooling such as speech to text or predictive analytics. Record keeping largely is driven by government and regulatory standards, and there is a kind of lack of person-centered information, and sometimes these records have little or no meaning to the individual, which is why it's really important to kind of reconstitute this and think about it from the person's perspective. What else did we learn? So we discovered that legacy solutions themselves are costly and can be outdated in some cases. And again, there's that growing gap between what's possible with the modern technology that surrounds us and then what is available. So this in many ways can lead to inefficiencies, costly downtime and unavailable systems. And you might have had this experience yourselves of drawn out implementations that can last a number of years. This is preventing valuable data being drawn down to inform our early intervention efforts. It's also a barrier to effective data sharing across agencies. And this is of growing importance as we see systems level changes with the ICBs coming into place and the growing importance of integrated service teams for effective care delivery. Importantly, this also creates a barrier to entry for new tech providers who want to consume pieces of data or share pieces of data back to social care teams. There is a lack of kind of an integrated offer in some cases. So this is contributing to an unclear picture of needs and demand in the sector and limiting the value of insight we can draw out of care management solutions. So what else did we discover? So on the screen, there's a few kind of insights that we think are really important and actually drove our design decisions and the choices we took in terms of the system itself. So social work suffers from bad data practice. We often found that people would be copy and pasting care plans or information into cases, which naturally doesn't lend itself to really person-centered record keeping. We also found that social workers are spending more time serving data requirements than care user needs in some scenarios, and that these data needs are not being met for really fast-changing care user situations. Empowered users are happier people. Care users have needs and desires around data capture, communication, and privacy that are inadequately met by current systems. Patchwork policies paralyse critical data sharing. So what we mean by this is fears of violating GDPR and other privacy laws deter openness and data sharing. And this is something that really needs to be tackled to enable us to have that modern information highway where we can share data really easily. And lastly, creative commissioning for real lives needs rich and accessible data. So commissioning for outcomes beyond financial efficiencies requires information that's not currently captured or shared effectively through database solutions. So these are the kind of design drivers for us and the kind of challenges we're trying to address when we're thinking about our solution. So how is Casey looking to address these challenges? Well, it's a cloud-based care management system looking to address those unmet data needs in social care and give local authorities more control over the tools they use in social care. So this is our initial concept sketch that we came up with, and I thought I'll bring this back to kind of show you the journey that we've been on. So we are looking to develop a single platform for both children's and adult services. And the key aims of the platform really are to provide better working conditions for frontline staff, using modern UIs and making it really intuitive for the teams. Care user empowerment, so we want to give access points to people that receive care, provide them with the information they need, provide strong security to support that. Importantly, we want it to tell the right stories. So we want records to be dynamic, to change and to adjust. And that means bringing in information from other data sources and making that visible on records. And lastly, we want the CMS to be a trusted partner in work, giving meaningful data back as well as keeping it secure, facilitating collaboration across agencies, authorities and service providers. Around the edges there, you can see some of the tooling that we're hoping to develop. So outcomes trackers, comms platforms, digital engagement tools, and a whole host of other things that we think sit in and around the core case management offering. And what does this mean for businesses? What does it mean for local authorities? So in terms of business benefits, we're looking to provide faster solutions, offer you the benefits of continuous deployment and improvement, reduce failures and rollbacks by using modern microservice infrastructure, providing API gateways out the box that provide excellent interoperability, and really trying to accelerate that journey from legacy solutions to modern cloud infrastructure as well. So just some of the benefits we're hoping to achieve. And kind of really importantly for me, the key aim for us is to reduce that burden of data management and collection by empowering social workers to focus on the people they are supporting. So how does the solution do that? I won't give you a live demo of the solution today, but I will talk you through some of the kind of key principles in the design of the system. So user-friendly interfaces. So we're trying to support clear visibility of cases, helping social work teams with clear visibility of timescales, upcoming deadlines, and actually providing this within a native mobile application that is easy to update cases on the go with our case note feature or our case histories that give really clear, visible cues to show how a case is going or show some information about that individual. So our person-centered case files offer modern design patterns that you would recognize. So for example, timeline views and our case chronology view gives visual cues to support social work practice. One of the challenges that we did hear from social work teams was creating case chronologies can actually be quite a lengthy process. So what we decided to do is make it kind of integral to our system, that a case history is kind of visible on the record as you work through it, and it builds up over time. providing clear visibility of case history and tying into new pieces of information that you might drop into a case, be that a case note, a new care plan. It will all appear on that chronology, and you can run that off really quickly. So that modern timeline gives you kind of clear visibility of cases and individuals and their histories. Data standards. So we're always tied into the best practice in data standards and adopting these from across the sector. So NHSX and the PRSB, who we are a supporting member of. So, for example, our About Me solution that is following best practice and data standards, and all of this is really easily shareable. So through our API framework, you could get an About Me or push an About Me, and all these data standards, as I say, tying in with the best available information from the health sector as well. So if there's a health standard available, we've adopted it and tied into the NHS standards as well. So lastly, from a system admin perspective, one of the key user needs identified for our research program was the need to have a secure database on a platform that enables local configurability. Our modern tooling, in terms of our flexible form builder and workflow engine, allow system admin teams and social work teams to adjust workflows or forms without additional development costs. So one of the things we often hear from social work teams or procurement teams purchasing these systems is the ongoing licensing and the ongoing cost to them are quite high to configure or change the system to meet the local context or local arrangements. Furthermore, additional features or new functionality that comes on stream are always incurred at an additional cost as well. So one of the things we're trying to change is to offer a modern solution that develops over time. It is a solution for the future that grows with you and grows with the needs that you have. So I think I'm about in time. And whilst case is still under development, there is a live prototype available for demonstration. So please contact me at the address that you see on screen there if you want to find out more about this or see the live system as well. So thank you very much for your time today. I'm going to hand back to John.
Thank you to Craig, Natalie and Sherry for their deep dives. As we've said at the beginning, all of these solutions, more information is available. If any of you want to follow up, please follow up with us and we'll put you in contact. It just falls to me now to say that that's the end of this session. Our next is a transform talk about customer focus and congruence at 11:45. This will be live streamed onto the conference portal homepage. So I look forward to seeing you there. And thank you to our speakers. Thank you very much indeed. That's the end of this session. Bye-bye.